A job that you would hardly believe exists. But it's real in the United States. There are people who get paid just to look inside other people's ears every day. It sounds strange, even a bit funny. But this is a real medical profession. A job that few people think actually exists. Is becoming increasingly necessary in modern life. And the most surprising thing is, it's directly related to your ability to hear. Just a small amount of earwax can be enough to take away the sounds of the world. That's why there are specialists trained specifically to deal with something that seems so simple. They are not major surgeons. But their work is extremely important. And here's a fact that surprises many people. They get paid to do this every single day. But behind this seemingly unusual job lies an entire medical world that few people know about. And the story of this ear inspection profession might make you see your own body differently. Before you think this is a strange or funny job, pause for a moment. Because earwax removal specialists are not a joke. In reality, they are called earwax removal specialists, a real position within the medical field. They don't just look inside people's ears, but perform medical procedures that require a very high level of precision. Every day, they work with patients who experience hearing problems caused by excessive earwax buildup. Some people have not been able to hear properly for months, even years, just because of something that seems so small. And their job is to safely restore that hearing ability. This is not an entertainment or quirky job as many people mistakenly assume online. It is actually an important part of modern ear, nose, and throat care. In fact, many general family clinics in the United States have stopped performing routine earwax removal procedures. This has led to a growing demand for these specialists. They are professionally trained, use specialized medical equipment, and must follow extremely strict protocols. Even a small mistake can cause serious damage to a patient's ear. So do not judge this profession by its simple appearance. Behind it is an entire medical field that requires focus, skill, and a very high level of responsibility. If you only look at the surface, many people might think this is an unnecessary job. But in reality, earwax examination and removal exists for a very simple reason: real medical need. In the human ear, earwax is not something useless, but when it builds up excessively, it can cause serious blockages. This can lead to reduced hearing, tinnitus, and even temporary hearing loss. In many countries, especially the United States, family clinics have stopped performing basic earwax removal procedures. The reason is the increasing medical risk and the high level of technical skill required. This has created a gap in the ear, nose, and throat healthcare system. And it is exactly this gap that led to the rise and development of earwax removal specialists. They use modern technologies such as microsuction to safely clean the ear. It is no longer a simple ear rinsing procedure like in the past, but a strictly controlled medical process. In addition, an aging population has significantly increased the demand for this service. Many elderly people suffer from long-term earwax buildup and require regular treatment. Even some younger people experience issues due to improper ear cleaning habits. Because of this profession does not just exist. It is becoming increasingly important. And in the future, the demand may grow even further. To truly understand this profession, we need to look at their actual day-to-day work. It is not simply about looking inside people's ears, but a structured medical procedure with clear steps. First, they use a device called an otoscope to examine the inside of the patient's ear. This tool allows them to see deep into the ear canal and assess how much earwax has accumulated. After the evaluation, they decide on the most suitable treatment method for each case. One of the most common techniques is microsuction, using a small vacuum device to remove earwax. This method is much safer than the traditional ear irrigation used in the past. In addition, they may also use a manual instrument called a curette to remove earwax more precisely. All procedures must be performed with extremely high accuracy, as the ear is a very sensitive organ. Even a small mistake can cause pain or damage to hearing. Throughout the process, they continuously communicate with the patient to ensure comfort and safety. Many patients feel anxious, so psychological reassurance is also an important skill in this profession. After completing the procedure, they check the ear again to ensure it has been fully cleaned. They also guide patients on proper ear care to prevent the problem from returning. Finally, the entire process is recorded in medical records for long-term monitoring. There are many things about this profession that most people have never heard of. For example, not everyone knows that earwax actually plays a protective role by trapping dust and bacteria. But when the body produces too much of it, it becomes a serious medical issue. A lesser-known fact is that many patients only discover their hearing problems after severe blockage has already occurred. They can live for months with reduced hearing without realizing the real cause. This makes earwax removal specialists far more important than many people think. Another surprising point is that not all countries have the same standards of ear care. In the United States, many earwax removal services have been restricted in general family clinics due to medical risks. This has made specialized professionals a safer option. In addition, modern microsuction devices can remove earwax without the use of water, unlike older methods. This helps reduce the risk of infection and ear damage. Few people realize that some treatments take only a few minutes but can completely restore a patient's hearing ability. There are cases where people enter a clinic almost deaf and leave with normal hearing restored. That is why this profession, although it may sound unusual, carries very real medical value. Many people, when they hear about this job, often assume the income must be very high. But in reality, that is not entirely true. In the United States, an earwax removal specialist typically earns around $17 to $26 per hour. That is roughly $25,000 to $50,000 per year, depending on experience and location. This is not a get-rich-quick salary, but it is enough to provide a stable living. Many people working in this field choose the job for stability rather than money. They usually work in ENT clinics, audiology centers, or mobile healthcare services. Their daily work is not as loud or high pressure as major surgical procedures. However, it requires a very high level of focus in every small action. Even a minor mistake can directly affect a patient's hearing. This makes the job small in scale, but heavy in responsibility. Their lifestyle is generally stable, with a clear schedule and little fluctuation. However, they also face unpleasant situations on a daily basis. Still, many continue in the profession long-term because of the feeling of helping others hear the world again. Few people talk about the psychological side of earwax removal work, yet this is actually one of the most important aspects of the profession. They don't just work with medical equipment, but also directly with human anxiety. Many patients feel afraid when something is inserted deep into their ear. This requires practitioners to maintain absolute calm at all times. They must create a sense of safety from the very first seconds of the interaction. On top of that, they also deal with situations that can be quite unpleasant from a sensory perspective. But instead of reacting negatively, they must remain professional in every circumstance. The greatest pressure does not come from the technical procedures, but from the responsibility toward the patient's hearing health. Even a small mistake can have long-term effects on a person's life. Because of this, the level of focus required in this job is consistently very high. In addition, they must learn how to communicate gently and reassure patients psychologically. Many people in the field say they feel pressure, but also a strong sense of meaning. Because they are not just cleaning ears. They are helping people regain the ability to hear and reconnect with the world. After learning about this profession, you may no longer see it the same way as before. A job that seems strange at first glance, but actually carries very real medical value. Every day, people in this field help others regain their ability to hear. They work in silence, without fame, yet create a significant impact on their patients' lives. And what is worth thinking about is, this is only one of many unusual but real jobs out there. The world has countless professions we have never heard of, yet they quietly keep society running. So the question is, if you discover a job like this exists, would you look at it with curiosity? Or would you be willing to try experiencing it yourself? And if you had to choose, would you dare to work in something involving these kinds of less pleasant tasks?